The row surrounding our emergency
In
departments
hospitals
isn't
across
going
England,
away.
the pressure
Patients
is
don't know
unrelenting.
whether to expect crisis
Lying
conditions.
in beds they no longer need. We know it as bed blocking, but the reality is it clogs up and slows down.
What's it like here? It's busy.
Dangerous. Yeah, it's frightening.
We know that our emergency departments face ever-increasing pressures, and indeed many have not recovered since last winter. Those pressures in the main are due to crowded emergency departments.
These nurses and doctors are working really hard, but there just isn't enough of them. There's people lined up in corridors on beds, there's people stood appalling here, there ain't even enough seats to sit down. It's absolutely appalling.
The simple fact is that crowded emergency departments are associated with added risk of dying in hospital. This short video highlights some of the challenges and indeed the solutions that we ask hospital boards to focus on this winter.
We have devised this traffic light system. This is to help boards understand what's going on with their emergency department and indicate where they need to take action.
So an emergency department that's doing well and has good performance is a department that has flow. And you get flow by making sure that the patients that don't need to come through the emergency department don't come through. So there are alternative pathways for them. And patients who can be managed in the community are staying in the community. But most importantly, it's a department that has flow because there are beds for patients to go to when they need that bed.
One of the first things we notice when we go into Amber is that we're not getting to patients as quickly as we might, and it takes longer to get patients into cubicles so that we can see and treat them. Sometimes it even means that we have to start delivering care in the corridors. Statistically, we know that once we're in the amber zone, patients start to come to harm because it's harder to treat them. We also know that they stay longer in hospital and may become sicker or may even die as a result of the delays in their care. The board should be acknowledging that this represents a significant risk to patients by putting this on the risk register. But just putting on the risk register isn't enough. The board needs to discuss the problem and take action to improve the situation. There are a number of measures which can be taken to escalate the ability of the hospital to cope. The first thing is that extra staff should be brought into the emergency department and the emergency care pathway to make sure that patients can be looked after safely. We also need to consider how we can create extra capacity in the hospital. This may be by enacting what's called a full capacity protocol to put extra patients on wards, or it may mean the cancellation of some surgery. The key, however, is making sure that flow through the whole system is as good as possible so that patients can be discharged home, creating more space for those patients who need to be in hospital.
If your hospital is in the red zone, this is an indication that your whole hospital is in a state of crisis. It is unsafe for the patients in the emergency department. There will be avoidable harms happening to patients in those departments. Boards need to take action.
What's it like here? It's busy.
Dangerous. Yeah, it's frightening.
So if you're in the red zone, your staff are looking after people in emergency department corridors. There will be people waiting outside in ambulances waiting to offload. This is bad for patients. It's also bad for staff who feel frustrated they're not able to do a good job and look after people properly. The solutions are not complicated, but they are difficult. What boards need to do is prioritise early discharges so every morning there are enough beds so people can move smoothly through the emergency department. Eliminate exit block. Boards need to have robust escalation policies. They need to follow them. They need to support their staff, and this may mean involving extra staff to support the emergency department, particularly to make sure there are adequate nurse staffing ratios and the patients who are being looked after in corridors are still being looked after.
We want to do all we can to improve safety and clinical care for our patients this winter. There are a range of materials on the college website that we would recommend.
Trust boards tackling emergency department performance are the ones that recognise that it's a trust-wide challenge.
None of this advice is for next year. This is all action that boards and hospitals should be taking right now to improve patient safety in emergency departments.
This is about working together and showing true leadership in these tough times so that we can keep our patients safe and provide dignified care that they deserve.